Hey everybody, my name is Heather and I'm here to do a video on COVID-19 and pregnancy, otherwise known as coronavirus, the pandemic that we are all dealing with right now. So recently I've been approached by a lot of other expecting mamas who are pregnant currently and just trying to get some information on pregnancy and the pandemic that we are all dealing with right now. As a disclaimer, I am not a physician or a scientist. I am in the medical field. I am a nurse that is currently working Monday through Friday full-time, and I am currently about to be 26 weeks pregnant. This video is going to be a collection of information read from reliable sources such as the CDC.gov, WHO, and interviews with physicians from around the world. As we all know, information is changing day to day, but here is some information that I have gathered on COVID-19 and pregnancy. During pregnancy, women's immune systems are naturally weakened. This is so their bodies don't reject the developing baby. This does put them in the higher risk category for contracting viral infections such as COVID-19. It is highly suggested that pregnant women limit their social interactions and really practice social distancing and isolation if necessary to protect themselves and their baby. First, some general facts on COVID-19. This is a respiratory virus that is found in droplets that are streamed into the air, especially when you cough or sneeze. This virus can also be found on surfaces, and it is believed that this virus could live on surfaces for a few hours up to several days. This virus is thought to spread mainly from person to person who are in direct contact with each other, and that means within 6 feet of one another. So therefore, social distancing is suggesting that you have at least 6 feet between you and the person that you're talking or interacting with. The incubation period, meaning the time that you may have caught the virus to showing symptoms, is believed to be about 1 to 14 days. Symptoms may appear either 2 to 14 days after you have come in contact with the virus. So if you start to experience any symptoms such as fever, which a fever is considered to be anything over 100.4, persistent coughing, shortness of breath, or any flu-like symptoms, you should call your provider right away. If you're pregnant and something just doesn't feel right, make sure you speak up right away. It doesn't hurt to call your physician and just tell them how you are feeling, and then they can help you judge what steps to take next. But most importantly, it is very important to call ahead. Do not just show up at your physician's office or an ER with symptoms that may suggest that you are positive with the COVID-19 virus. Calling ahead can make sure that they even have the capabilities of administering a test to test you for this virus. If you are having any severe symptoms, make sure to call 911. That's the emergency number in the United States, but make sure to call whatever your emergency line is in your country. If you are having symptoms such as difficulty breathing, persistent pain or pressure in your chest area, new confusion or the inability to arouse, or if you notice that your lips and face are turning blue, or if your significant other notices any of these symptoms. So let's talk more about pregnancy and COVID-19. Again, this is information that I have gathered from doing some research online from credible sources. According to studies, pregnant women are more prone to getting respiratory illnesses like COVID-19. And they are at greater risk when they're farther along in their pregnancies because this could make it difficult to breathe. And we all know that being pregnant and being that pregnant makes it difficult to breathe in general. So on how coronavirus affects pregnant women, other than normal symptoms that the general public can experience, unfortunately, since it's so new, they're still trying to gather as much information as they can on how it affects different people differently. So in China, studies have shown that the virus is not likely to travel from mother to baby in utero, and no studies have shown so far that it causes any birth defects. Also, as of now, they have not detected that the virus is transmitted or carried in the breast milk. A little on delivery and COVID-19 that I've come across. Definitely, number one, discuss your concerns with your provider. If you're a pregnant mom who has tested positive for COVID-19 and you are going into the hospital for your delivery, you will be put on isolation precautions. From information that I've obtained, it does not seem like a vaginal delivery would be contraindicated if you do test positive for COVID-19, but definitely your provider would give you more information and direction on that. It is definitely not suggested to suddenly opt for a home birth if what you have been planning for your entire pregnancy was a hospital birth, especially if you're delivering in the next couple or few weeks. Home births do require some preparation, so also you can check with birth centers in your area to see if they have any openings, if that is something you would rather choose to try and do. From what I've read, they say you should try to avoid an induction, but sometimes that can be medically necessary, so again, check with your provider and listen to what they suggest to you. Definitely try and labor at home as long as you can. Just call your OB and check in with them, let them know how far apart your contractions are and how you're feeling, and they can suggest to you further when to actually come into the hospital. The idea is to limit the time in the hospital as much as possible, especially during these critical times. As of right now, a lot of hospitals are limiting visitation to one supportive person per patient, which means either your significant other, or if you are a single mom, maybe your doula or your mother, but it's not your significant other and a doula. Unfortunately, this is what I'm hearing. No photographers are going to be welcome in the hospital. It's just that one supportive person per patient. Other information that I've been hearing is they will screen your partner and you also as you're entering the hospital. And if your partner does have a temperature greater than 100.4, at this time, the hospital may choose to take further precaution. So be aware. For more detailed information on birth and COVID-19, I'm going to link one of the videos that I found and watched down below in the description, along with the links to the CDC.gov and WHO. So postpartum and COVID-19, from what I've read, it is believed that if mom is positive with COVID-19, there is a possibility of transmitting the virus to the baby. So if you are in this situation and you are due to deliver soon, I would definitely check with your care provider and see what precautions they plan on taking. So treatment, if you test positive and you are pregnant, from my understanding, if your symptoms are mild and you can manage them at home, the recommendation will most likely be home isolation for 14 days. And that's for more mild symptoms to help not spread the virus. For more severe symptoms, they would admit you to the hospital on a special isolation unit where they would then help you get over the infection. Prevention, I'm gonna put my Instagram photo here. I have a list of ways to help prevent the virus. Specific things are definitely hand washing, social distancing, isolation, using hand sanitizer, covering your mouth with a bent elbow if you are coughing or sneezing. If you are sick, definitely you can wear a mask, but at this point it is not suggested that healthy people go around wearing personal protective equipment, PPE, because it is highly needed in hospitals right now. The supplies are running low, so if you do have any PPE that you are hoarding in your house, try and donate it to a hospital. They are in great need of personal protective equipment, dealing directly with patients who are positive for COVID-19. Try to avoid contact with people who are sick. If you can work from home, it is a great idea to try and work from home. But again, social distancing, avoiding crowds. Definitely don't plan on traveling. Make sure to clean and disinfect highly trafficked areas in your home. Things that are touched often, definitely your cell phone. Try and remove your shoes when you're entering your house, and also try and maybe remove your clothing after you enter your house. Put different clothing on. If you have any further questions after watching this video, make sure to contact your physician. And again, I am not a physician, a scientist. I am currently working in the medical field as a nurse, and I am about to be 26 weeks pregnant. This video was a collection of information that I've gathered from reliable sources, from the CDC.gov, WHO, and then physicians that have been interviewed around the world. Just remember to stay safe, continue following standard precautions and social distancing, and try and remember peace over panic, faith over fear, and wisdom over worry. And always remember to be kind to one another. Everyone is definitely on edge during this crisis. The anxiety levels are high, and people may say or do things that they don't mean. So just give people the benefit of the doubt and try and be one of the those calming people that come around, not one of those people that introduce fear and anxiety and panic. Everyone be safe. Here is my bump. She is about to be 26 weeks gestation. And we are just trying to stay positive and have faith while we deal with this pandemic. And I suggest that everybody else just have faith and enjoy your pregnancies.